This is Hilary Eslin presenting a case study for Assignment 2 entitled A Case of Preeclampsia. Meet Susan. She's 19 years old, overweight prior to pregnancy, and does not follow the healthiest diet. She eats 1 serving of fruits or vegetables per day, rarely consumes dairy products or whole grains, drinks chocolate milk and sweetened tea daily, and most of her meals are meat and potatoes or occasionally rice. She rarely remembers to take her vitamin and mineral supplements. Let's follow Susan through her pregnancy to see how her diet affects not only her health, but also the health of her fetus. At 18 weeks, Susan was diagnosed with proteinuria, which is characterized by a larger than normal amount of protein being excreted in the urine. At 22 weeks, Susan's blood pressure was elevated and she was diagnosed with preeclampsia, which can cause a decrease in nutrients being passed through the placenta to the fetus, among other complications. Labs also confirmed elevated blood glucose levels, showing Susan was insulin resistant. After 22 weeks, Susan was lost to follow-up, but she did not gain weight during her pregnancy and purposely limited her salt intake. Her baby was delivered at 36 weeks via cesarean and weighed just 5 pounds, 5 ounces. Preeclampsia, a form of hypertension, is a syndrome specific to pregnancy that is characterized by elevated blood pressure and is coupled with proteinuria. It correlates strongly with oxidative stress and inflammation. It's likely Susan's dietary intake contributed to this state of oxidative stress prior to and early in her pregnancy, which contributed to the development of preeclampsia. It is recommended that pregnant women consume at least 5 servings of fruits and vegetables every day. Susan eats 1 serving most days. Her diet is severely lacking in the antioxidants found in colorful fruits and vegetables. Without dietary antioxidants, her body cannot keep up with the extra free radicals that are produced during pregnancy. Susan eats a lot of meat, which can contain large amounts of saturated fat, which contributes to oxidative stress. Susan drinks chocolate milk and sweetened tea daily, both of which contain large amounts of added sugar. A diet containing large amounts of added sugar contributes greatly to oxidative stress. Susan's lack of weight gain during her pregnancy indicates she was not taking in enough energy to maintain her own health while growing the fetus. Hoping to lower her blood pressure, Susan began limiting her salt intake during the last half of her pregnancy. Limiting sodium intake is not recommended for pregnant women, and there is no evidence linking lowered salt intake to lowered blood pressure in pregnant women. If sodium intake is too low during pregnancy, the growth of the fetus could be affected. Another concern with Susan's diet is the possible lack of calcium, which is found most abundantly in dairy products, fish like salmon and sardines with the bones eaten, and some vegetables including broccoli and cauliflower. Susan does not eat fish, broccoli, or cauliflower, and the only dairy she consumes is her daily serving of chocolate milk. Also, Susan consumes tea throughout the day, which likely contains caffeine. While caffeine itself is not a major concern, it can lead to increased calcium losses. Because Susan stopped seeing her doctor after week 22, there was no way to know what her sodium and calcium levels were. Preeclampsia has been linked to increased risk of developing other serious and chronic diseases. Studies have shown a nearly 2-fold increase in the development of diabetes mellitus later in life after a preeclamptic pregnancy. During pregnancy, the fetus requires large amounts of glucose from the mother's body. Her body decreases its sensitivity to insulin to make this glucose available. In cases of preeclampsia, this insulin resistance can persist for many months after delivery, increasing the risk of developing diabetes. Women who have had a preeclamptic pregnancy are also at greater risk of developing cardiovascular disease later in life. Susan's current diet, high in saturated fat and added sugar, and low in whole grains, fruits, vegetables, dairy, and healthy fats will contribute to this risk. Increased risk of developing kidney disease has been linked to preeclampsia as well. Having preeclampsia in one pregnancy increases the chance that it will occur in subsequent pregnancies and that chronic hypertension will develop. Preeclampsia can also increase the risk of the offspring developing hypertension and cardiovascular disease later in life.